Mr. and Mrs. Brown. My name's
Hi.
Erin, and I'm going to be your nurse today. Can you just tell me your name and date of birth quickly?
Yes, my name is Al Brown, and my date of birth is 10/1/78.
All right, thank you. So I understand Dr. McKellar was in here just a little bit ago to explain the pain and the DVT in your leg.
Yeah.
Did you understand that, or do you have any questions?
Yeah, no, she just said that I had like a clot in my leg, but I don't really know what's the big deal about that.
That's right. Your blood in your leg formed a clot, and that's got a risk of growing larger or of breaking off and traveling somewhere else in your body where it could cause problems.
Oh, is it kind of like my friend Susie? She had a stroke.
Not quite. If the clot breaks off, it wouldn't travel to your husband's brain, but it could end up in his lungs, and that would still be a medical emergency. But that's why we're sending you home with 2 anticoagulant medications. One is Lovenox, and that's going to start working today after we give it to you. The other one is Warfarin, and that's going to take a little bit of time to build up to its full effects.
Okay, so I assume these are pills, so like for how long am I going to have to take them? And you know, I'm okay with taking medicine as long as it doesn't have like any bad side effects or anything.
Well, the Lovenox is actually a shot that you're going to have to give yourself in the abdomen twice a day. The Warfarin is just a pill that you'll take every night by mouth.
Okay, so you mean I'm going to have to give myself a shot? Because, you know, I really hate needles. I don't know if you remember when they gave me my flu shot this fall. I almost passed out when the nurse gave me the shot.
Honey, maybe I can give your injection for you. Is that okay, Erin?
Sure.
That would be fine if your wife wants to give the shot, but it is going to be really important that you still watch what we're doing and you understand everything that's going on, just in case you did have to give it to yourself.
Okay, I can try.
Okay. Well, I brought in this little practice pad and then your actual Lovenox dose and some stuff to demonstrate, and then I thought, Mrs. Brown, you could actually give the injection of Lovenox today if you're comfortable.
Okay, that would be nice.
All right. Well, let me pull this up a little and we can all watch.
Okay.
So, the first thing you're going to do, most importantly, which I already did, is wash your hands before you do any of this. And then you're going to have Mr. Brown, your husband, lay back and select a spot on his abdomen for the Lovenox. It's really important that the Lovenox only goes into the abdomen, that it doesn't go into the arm or the leg or something. And when you pick that spot on the stomach, pick an area about 2 inches away from the belly button. So stay up in these quadrants. And avoid an area that's already bruised or irritated or that might rub against your clothing a lot. And then every time you give a dose, it's important that you rotate spots. So if you give one dose down here, give the next one up here and kind of go around in a circle.
Okay.
Okay? So then once you pick that spot on the abdomen, you're going to open up an alcohol wipe and clean the area for 15 seconds. Clean it really well. And then you're going to want to let it dry entirely after you do that, so that it'll actually help the injection to sting a little bit less if it's not alcohol over your skin. And so here's the actual Lovenox. You're going to get 70 milligrams, and that's based on your body weight. And just while that dries, make sure you don't touch the area again, because that'll just get it dirty again. And then when you're ready, you pinch up a good chunk of skin. You'll do that on his stomach. And just get the needle ready to go straight into the abdomen. You want to go nice and quick and push down. And are you ready to watch?
Yeah. So I go fast, not slowly, to make it hurt less.
No, it'll actually hurt less if you go faster.
Okay.
Oh,
Okay.
Okay?
I'm ready.
All right. So put it here. And in we go. And then let go. And you're all set. It shouldn't be too bad.
Okay, we can try that and see.
Okay, ready, honey?
And then when you're all done, it's going to go in the sharp switch like this.
Okay.
So let me move this out of the way. And here is your Lovenox and an alcohol wipe. And I'm just going to be right over here.
All right, so the first thing I would do is wash my hands, right? Perfect. Okay. Pick a spot on his stomach. That looks like a good spot. Okay, now I'm going to want to this. You said 15 seconds?
Yeah.
Okay, it's been 15 seconds.
Good. Here, I'll take that from you.
Thank you. Okay, let it air dry because I don't want to touch it.
Mm-hmm.
Okay, go ahead.
Feels like it's dry now.
This feels like it's dry now? Okay, perfect. Get my needle ready.
Do I have to watch?
No, you can look away for now.
Okay, I'm going to pick up a little piece of skin. Go at a 90-degree angle.
Yep, go right in.
Project the lid in. Pull it out. Did that hurt, honey? I'm just going to rub it.
That wasn't too bad.
Mrs. Brown, actually, you did a really good job, but you don't want to massage the area
Oh.
because that could actually cause him to form a bruise or be more likely of bleeding from that area.
Oh, thank you so much for telling me that. Is there any other concerns that we should have?
Yeah, so while you're on this medication, there are some things you're going to need to avoid. You don't want to take any other blood thinners like aspirin or NSAIDs like Advil. You're going to need to reduce the amount of garlic and onion in your diet and avoid chamomile tea. And then you also want to be careful with your alcohol consumption. And then the other thing, this medication is only stored at room temperature, so you don't need to worry about putting it in the fridge or anything.
Okay, thank you.
Okay.
Well, I'm glad you tell me that because I take Advil sometimes after I work out because my knees hurt a little bit. And I guess I'm going to have to watch how much beer I drink when I watch my Duke games on TV, I guess, right?
And honey, I think I'm going to have to cook the food more blandly too because you said no garlic and onions, right?
Yeah, just keep it to a good minimum.
Oh, okay.
Okay. Well, it sounds like you two understand the Lovenox really well. Do you want to sit down again, Mrs. Brown?
Yes,
and we can
please.
talk about the Warfarin that you'll be taking, just those pills that you'll get from the pharmacy. It's going to be 5 milligrams. You're going to take it every night. It's important that this medication is taken at bedtime.
Okay.
And you're going to have a lot of the same things to look out for.
Oh, that's good. So it's pretty similar to the other medicine.
So no garlic, no onion.
Yep, no, you're right on. Perfect. No garlic, no onion. Stay away from aspirin and Advil again. Careful with the alcohol. With this medication, also avoid cranberry juice. And then with both of these medications, you're going to want to look out for signs of bleeding because they will put you at an increased risk. You are going to be a little bit more likely to have bruises form or maybe have a nosebleed. You might notice red spots in your skin. Those shouldn't be of great concern unless you definitely need to call your doctor if you have a lot of blood coming out of anywhere, if you have a head injury or a sudden severe headache. Those would be signs where you need to call. And then also, if with either medication while you're at home, you have signs of an allergic anaphylactic reaction, that would be hives, a rash, swelling, or a lot of trouble breathing. Okay?
So the second medicine that you mentioned, the Warfarin, right?
Yeah.
That's a pill, right?
That is
Oh,
that
okay,
is
that's
that pill,
great.
that
That's
5
great.
milligrams
Okay.
at night. And with that one, same thing. Like I said, you're gonna need to also like watch out for your gums. If they're bleeding, look for blood in your urine or in your stool. That could be dark and tarry, or it could be bright red, like you might expect. And then while you're on these medications, it would be a really good idea to switch to a soft bristled toothbrush. And then if you decide to shave your beard, to use an electric razor.
Oh, okay, I see. I think we can do that. Right? Yeah.
Okay.
How about any foods? Are there any foods that we should be watching out for?
We did mention the onion and the garlic.
Also about the same medicine, the same foods.
Yeah.
I mean, yeah. Okay.
Yeah, the same foods.
Okay.
So, do y'all have any other questions about either of these
Do you?
medications?
No.
No,
Did we
no.
talk about any frequent blood work that he needs to get done?
Oh,
That's right. I forgot to mention that. So, you do have a follow-up appointment scheduled in 3 days at the clinic with your doctor. At that point, she's going to draw some labs, take some blood work, and see how well your blood is clotting with both of these medications, and if it's safe to stop the injections that I know you don't like
Yeah.
at that time. And then as far as frequency going forward, you do have to get regular blood work done with the Warfarin. And as far as how frequently, that's going to be on an individual basis.
Okay.
So she'll talk with you about that, and then you're gonna keep taking the warfarin until she reevaluates that deep vein thrombosis in your leg, and she'll let you know when it's safe to discontinue it.
Okay, that sounds like a good plan.
Okay.
Well, thank you so much for your help. I appreciate it. Because can I just get changed and leave?
Yeah, yeah. You can get your
Okay.
stuff together and you checked out.
Okay.
In the meantime, I will be in the hall, so just grab me if you have any other questions.
Okay, thank you so much.
All right. Bye.
Bye. Oh, hey, Erin, one question, please.
Yeah.
Sorry.
What's that? Sorry.
Yes.
In the notes over here, it says that we should avoid vitamin K.
Yeah. So do you all know what foods contain vitamin K?
Not really.
No.
That's okay. That's okay. Those are leafy green vegetables, or some stuff like broccoli and Brussels sprouts are really high in vitamin K. And you're gonna need to keep the amount of those type of foods constant in your diet. Don't eat a lot more all of a sudden or a lot less, because if you do consume a lot of vitamin K, it can actually counteract the effects of the warfarin, so it won't be as effective.
Oh, okay,
Ooh.
okay. All
Thank
right.
you so much for
Thank you.
sharing.
That was it. Thank you very much. I
Absolutely.
appreciate
All
it.
right. Well, you take care now.
All right, have a good day.
Bye,
See you.
Erin.
Bye-bye.